Our topic is on white blood cells, and it's by Sophia Candova, Bahar Nadiri, Kimberly Joyner, and Laura Fugleberg.
White blood cells are also known as leukocytes, leuko meaning white and cytes meaning cell, as they are colorless due to the lack of hemoglobin. There are about 6,000 to 8,000 millimeters of white blood cells for 1 milliliter of blood. These are also called scavengers and microscopic policemen.
Here we see the different types of white blood cells. From left to right, there are lymphocytes, monocytes, eosinophils, basophils, and neutrophils. We will now discuss the various types of white blood cells.
Granulocytes have large granules in their cytoplasm. The three different types of granulocytes are neutrophils, eosinophils, and basophils.
Neutrophils are the most abundant type of white blood cell in mammals. During the beginning phase of inflammation, they are usually due to bacterial infection, environmental exposure, and some cancers. And they are one of the first responders of inflammatory cells to migrate towards the site of inflammation. Because they are highly motile, neutrophils quickly come together at the source of infection. They are attracted by cytokines and are expressed by activated endothelium, mast cells, and macrophages. Neutrophils release cytokines, which in turn amplify inflammatory reactions by several other cell types. In addition to recruiting and activating other cells of the immune system, neutrophils play a key role in the defense against invading pathogens. They have three ways for directly attacking microorganisms. 1. Phagocytosis, or ingestion. 2. The release of soluble antimicrobials. And 3. The generation of neutrophil extracellular traps.
Basophils are a type of white blood cell produced in the bone marrow. They make up about 0.5% of the total number of white blood cells, making them the least common. Basophils can circulate in the blood and also are found outside blood vessels throughout many tissues in the body. Basophils protect the body, killing bacteria and parasites, including external parasites such as ticks. They can cause problems when they react incorrectly and cause allergies, asthma, and other inflammatory reactions in the body. They contain histamine and heparin, a blood-thinning substance produced by the body. The histamine that is released by basophils is the source of the symptoms of common seasonal allergies such as watery eyes, itchy skin, and runny nose. This is why antihistamines, which block the actions of histamine, are effective for reducing these symptoms. Basophils are part of the innate immune system, which means that they can non-specifically destroy any invaders that they encounter in the body, such as bacteria and parasites.
Eosinophils are a type of white blood cells produced in the bone marrow. They make up about 1 to 3% of the total number of white blood cells. They can circulate in the blood and also are found outside blood vessels and other organs in the body. The GI tract typically has the highest number of eosinophils relative to other organs. Eosinophils protect the body, killing bacteria and parasites, but can cause problems when they react incorrectly and cause allergies and other inflammatory reactions in the body. For example, food allergies can cause too many eosinophils to gather in the digestive tract, which may lead to symptoms such as diarrhea and damage to the cell lining of the GI tract. Eosinophils are part of the innate immune system, which means that they can non-specifically destroy any invaders that they encounter in the body, such as bacteria and parasites.
Granulocytes are leukocytes characterized by the absence of granules in their cytoplasm. The granulocytes include the lymphocytes and monocytes, which will further be discussed on the next few slides.
A lymphocyte is a type of white blood cell present in the blood. When the general defense systems of the body have been penetrated by invading microorganisms, lymphocytes help provide a specific response to attack the invading organisms. They also help to protect the body against tumors. However, lymphocytes can also cause the rejection of tissues during organ transplants because they interpret these tissues as foreign invaders. Lymphocytes are formed in lymphatic tissue throughout the body. Lymphatic tissue are a network of fibers and cells that help protect the body against disease. Examples of places in the body where lymphocytes are made of lymphatic tissue include the spleen, thymus, tonsils, and lymph nodes.
Monocytes develop from the myelomonocytic stem cells in the bone marrow. They then go into blood, where they circulate for a few days in order to then migrate into tissues. In the tissue, they further mature into macrophages. Blood monocytes are heterogeneous and have two main subsets that have been described in human blood. Monocytes and macrophages play important roles in the immune defense, inflammation, and tissue remodeling, and they do so by phagocytosis, antigen processing and presentation, and by cytokine production. Monocytes migrate from the bloodstream to other tissues and differentiate into tissue-resident macrophages. They are kidney-shaped, and their lifespan is hours to days.
Thank you.
Thank you for watching our presentation.